Greetings to Dr. Crandy and my fellow classmates. Hello, I'm Celine.
Hi everyone, I'm Yuki.
Hi everyone, my name is Wang Hao from China.
Hi, I'm Magic.
Hi, I'm Lixian.
Today, our group will be presenting about the third ethical dilemma, which is, I have a client who told me that he is a HIV positive patient. As I know, he is sexually active and has not told his wife about it. Is it my ethical responsibility to inform his wife, in effect dangerous to his wife and others? So, through this ethical dilemma, the first issue arises is that the client is a HIV positive patient, but he is still sexually active. To analyze this issue further, HIV is an infectious disease. So, if the client remains sexually active without taking any precautions or actions to solve this problem, he might infect his wife and also other people who are in intimate contact with him, which causes a rise in HIV cases.
The second issue arises is that the client has not told his wife about his situation. To analyze this issue further, it can be seen that the client chooses pleasure instead of putting his wife's health condition in the first place. The client should understand that HIV can be spread through sexual activity, and if the client continues to be sexually active without informing his wife about his condition, his wife will not be able to take preventive measures when in intimate contact with the client, such as preventing the sharing of using towels. The wife also will not know that she is in a high risk of contracting HIV and conduct a medical checkup immediately to see whether she has been contracted with it or not.
So now, for the third issue that arises is that if the client informs his wife about his HIV conditions, it might involve marriage issue signs that the client is not sure where he contracted HIV from. To analyze this issue future, if the client were to inform his wife about his HIV conditions, this might lead to a fight, a blame, verbal or the physical problem, or even a divorcement, as the wife might think that the for the hand of the HIV may involve the extramural affairs.
Now, I would like to talk about the ethical issues that have arisen in this ethical dilemma. The first ethical issue is that the counselor does not know whether to inform the client's wife about his HIV condition because it is considered unethical to inform the client's wife or third party without authorization of the law. Moreover, it is also important to consider the client's best interests before deciding to share the information to the client's wife.
As for the second ethical issue that has arisen, the counselor needs to find a way to guide the client to be able to understand the importance of letting his wife know about his HIV condition, and also to understand the danger of being sexually active after knowing he is a HIV positive patient without putting the counselor values on him, which can also be explained as having counter-transfers towards the client.
So, in order to solve this ethical dilemma, there are actually a few ethical solutions that can be done by the counselor. Medical information is considered confidential in ethical consideration and is also protected by the law. So, the counselor does not have the right to inform the client's wife regarding the client's health condition without the authorization from the law or the client himself to do so. If the counselor discloses the client's information to another third party, the counselor is considered to be unethical and against the law, and the client has the right to sue the counselor. So it is preferably for the client to disclose his health condition voluntarily without any force and pressure from the counselor. According to the American Counseling Association Code of Ethics, at Section B2C, it stated that when clients disclose that they have a disease commonly known to be both communicable and life-threatening, counselors may be justified in disclosing information to identifiable third parties if the parties are known to be at serious and foreseeable risk of contracting the disease. Prior to making a disclosure, Counselors assess the intent of clients to inform the third parties about their disease or to engage in any behaviors that may be harmful to an identifiable third party. Counselors adhere to relevant state laws concerning disclosure about disease status. Besides, according to the APA Ethical Standard 4.05, it has stated that psychologists are allowed to disclose confidential information without the consent of the individual as only mandated by law or where permitted by the law for a valid purpose such as to protect the client, psychologist or others from harm. So, if the client is unwilling to inform his wife about his HIV status voluntarily, the counselor is allowed to disclose the client's HIV condition to the client's wife right after the counselor had applied for the legal permission or legal mandate to do so.
As it is unethical to disclose the client's information to another third party, the counselor should not inform the client's wife about his situation. So in regards to this decision, we have planned a series of solutions pertaining to these ethical dilemmas. So first of all, at the first consultation, it is vital to establish a good rapport and an empathic and supportive relationship as a basis for the client's future care. Clients often will get lost and unable to decide what to do with their life when encountered with such a situation. So building a meaningful connection and showing empathy for the client will mean that the counselor feels what they feel. This gives powerful insight into what the client is feeling, which can be used to help them understand and process their emotion. Besides, by having a close and harmonious relationship with the client, it will improve the chances for a successful outcome, along with developing mutual trust and respect, and foster clients' confidence level throughout the counseling sessions. By doing so, meaningful change is more likely to occur as there is perceived connection between both parties. After that, the counselor should be able to understand and be clear about the client's core objective and expectation of the counseling service, whether he is seeking a guarantee of confidentiality or is trying to find a way to solve his problem. So throughout the counseling session, both parties have to come to a consensus that whether the client will disclose his health condition voluntarily to his wife, or the counselor will help the client to inform his wife right in front of him if the client does not dare to disclose by himself. So after they have reached a consensus, the counseling session will be more effective and they will be able to work together more efficiently towards the desired outcome. So that's all from me. Next, I will pass it to Wang Hao. Thank you.
The counseling should be properly done, and the time spent with the client should be longer enough so that the counselor can gain the client's trust, and the client will be more open to talk about whatever he feels and think. So by gaining the client's trust, the counselor is able to share the information easily to the client, and the client will talk into the conditions, whatever the counselor said, and can learning to think in others' perspectives about his problems. So the client will be more understanding towards the counselor and will not have any misconception about the counselors, such as having the misconception that the counselor want to run the client and his wife's relationship. From there, the counselor should be inform the client about the law of not disclosing his HIV status to his sexual partner, as well covering his health status, must learn the client wife to be a harm of her health, as HIV is an effective design and disease, and his wife has the right to know about because she is in risk for the infection. It's also important for the client to know about the confidentiality of the client right to that he is also to be think more the additionally understand the counselor's limits, as well as his wife risk to the infection, and are willing to the confess to his wife voluntarily, and as well as informing his wife to conduct the bodily checkup to the test for the HIV.
The counselor should tell the client about all the information of HIV. In the first session, the counselor should explain to the client about HIV. For example, the counselor should explain to the client that HIV, namely human immunodeficiency virus, is a type of virus that attacks the human cell that fights for infectious viruses, causing the human to be more prone to other viruses. HIV will later lead to acquired immunodeficiency syndromes, whereby the patient will have their immune system damaged. After giving some important information about HIV to the client, the counselor should encourage the client to have a HIV test, such as the antibody test, which can find out the HIV through oral fluid or blood, and this can be done within 20 to 30 minutes. Not only that, the information about the treatment of HIV should be explained to the client. For example, antiretroviral drugs are proven effective to stop the virus replicating in the body. The counselor should also mention the benefits of disclosing the situation to their family members and relatives, as seeking help and support from family members will boost the treatment progress and encourage the client to face his personal issues and gain autonomy.
As we mentioned before, we also consider a situation where the client actually hopes to tell his wife about his condition. However, he does not dare to confess to his wife by himself. So after a few sessions with this client, a good relationship between the client and the counselor is established, and the counselor now is clear about the client's core objective and successfully created a sense of trust in the client. So in this circumstance, the counselor may request the client's permission to inform his wife about his condition right in front of him, which means that the client brings his wife along with him on the next counseling session, and during this session, the counselor helps to disclose his condition to his wife. After that, the counselor should give them some time to communicate, and the counselor may help the client to explain his previous behavior, which is concerning his condition, and also placate his wife's emotion to ensure the conversation is able to carry on. Other than that, couple therapy may also be considered in the future if needed. That's all from me. Now I will pass back to Celine to conclude our ethical solutions.
So, to conclude all of the ethical solutions that have been discussed, the counselor should build a good and trustable relationship with the client so that when the counselor explains about the importance of disclosing his HIV conditions to his wife, the client will consider to trust the counselor and have the thought of informing his wife voluntarily. Besides, the counselor can inform the client about the knowledge and information regarding HIV and also the benefits of testing and disclosing to his relatives regarding his conditions, so that he is clear about the disease and is able to think more rationally and have the consideration to disclose his situation to his wife voluntarily. If the client wanted to disclose his condition to his wife, but he does not dare to disclose by himself, the counselor can take a step to obtain the client's consent to help the client to inform his wife right in front of the client. However, if the client is not willing to disclose his condition to his wife, the counselor can take action by getting permission from the law to disclose the client's condition to the client's wife in order to protect her from having the risk of contracting HIV. Thus, no matter how the counselor wanted to disclose confidential information to a third party, he or she must have the authorization by the law or the client's consent to do so, in order to prevent unethical issues from occurring. That's all from our presentation. Thank you.